music has a purpose that's greater than entertainment.
Singing and health, I think, really are hand in hand.
Music is often a big part in speech therapy. I really do notice a difference between when I first pick up the patient and after they have had their session.
This work started for us a couple of decades ago, where we would bring in concerts and workshops and just general ways to bring music into a space to contribute to joy, contribute to healing. One initiative in particular that we've been working on together for almost 6 years now has been our virtual music and therapy program.
We get a little sheet every week about what the patients have requested. We take a little time to set a set list. We do a sound check on Zoom with our facilitator from LA Opera. We sign on with Rancho Los Amigos, and then the nurses and doctors bring the iPad into the room, and then we start our session.
So music is often a big part in speech therapy. There's something that's called melodic intonation therapy. People have aphasia. Aphasia is when they have difficulty with language, and that's due to damage in the left side of the brain. We are essentially trying to try to shift some of the language center over to the healthier right side of the brain, which is also the music side of the brain as well. We will have the patient select some functional phrases or sentences, and then we kind of sing-song through the phrase or the sentence, and they are often able to really start getting language out for the first time.
Porque con el stroke perdí un poco de movilidad en mi lado izquierdo y también un poco en mi habla, entonces tengo que tener estrategias para hablar. Me está enseñando a hablar un poco más pausado para poder decir las palabras más correctas, no hablar rápido, y para poder hacerme entender un poco mejor.
We're also trying to engage their left side physically, because that would be connected to the right side of their brain. So we like the patient to either tap on the table with their left, or we can tap for them as well, and that's sort of activating the music side, the healthier right side of the brain.
Something that's really notable is that LA County is a model for this work. In June 2024, the LA County Board of Supervisors passed a motion declaring it Arts and Health Week, as they do every year. But what was particularly significant about this motion was that they noted that the arts can have a positive influence across the social determinants of health. And that was a major declaration for us, because it reaffirmed the value of this kind of work and how the arts can really elevate our experience and help support well-being across our communities.
You can use music as a meditative tool. You can use music as a tool for anxiety. You can use music as a tool for healing.
It's amazing because I'm not a doctor. I have no medical background other than I know when someone needs some help and when healing is happening. We have a different sort of interaction at the beginning and end of session. After a session, a few minutes of music, and you see all of this sort of they want to share. And it's usually, I think, because something has been triggered, some memory, some thought, some feeling, some emotion.
¿Le gustó la música?
Me encantó. Muy bonita. Gracias a usted por cantar tan bonito.
We get to take them out of that room that they're in. We get to take them out of that experience that they're in. And we just see them just through music and how inspired they become through reliving life. And through reliving, become reanimated again, become, themselves.
Me sentí relajado, regresé a mi época de joven.
The interactions that come from that kind of work, totally worth it.
This has been a wonderful example of how we can work together and limit barriers and create more possibilities and more access for folks who could benefit from the arts as part of their healthcare. So I'm really excited that we get a chance to highlight our music and therapy partnership with Rancho Los Amigos as part of the LA County Arts and Health Week Summit.